Hello everyone. So today I am taking a topic which is important for the pharmaceutics background students. So this topic is tablet. So tablet historically the tablet is earlier it is called as pills. Now the pills which is mainly it was belongs to Egyptian. So Egypt's persons peoples they used to prepare pills for their disease conditions. So earlier, before that, it was around 1500 BC. Then earlier, around 4000 BC, they used liquid preparations. So now I am taking tablet topic for your benefit, and it is also included in our B.Pharm semester syllabus. The paper code is topic code is BP502T. It is available in 5th semester. So here everyone. I am Aditya Bora. I am Assistant Professor of Pharmaceutical Science Department, University of Science and Technology, Meghalaya. So here the tablet. So tablet is commercially mostly it is available. Mainly this tablet is used because it has high stability as compared to the liquid dosage forms. Tablets are mostly used because these are convenient to transport. It is economical. And we can use different coloring agents to distinguish different tablets. Like for pediatric, we can use pink colors, red means pink colors, yellow colors. So it will attract the patients or any pediatric patients. So here I am going to discuss tablets. Its content is tablets. We will discuss advantages, disadvantages, manufacturing components of the tablets, how we can prepare the tablets, and different type of defects during manufacturing. Then if possible, if time allows, I will discuss the quality control of the tablets. So let's begin. So definitions. So tablet is generally you might have seen that tablets are spherical oval type, but as per the Indian pharmacopoeia, the tablets is a solid, flat or biconvex dishes unit dosage form, and it is prepared by compressing a drugs or a mixture of drugs with or without diluents. So pharmacopoeia, you know students that pharmacopoeia is a official documents. The pharmacopoeia contains monographs, and each monograph is a document, written document. So it is a authentical material, means that is correct. If pharmacopoeia says we need to, means in the pharmacopoeia there are different tests. So if the pharmacopoeia says we have to determine the hardness, definitely in our formulation we have to evaluate hardness of the tablet. If pharmacopoeia says the dissolution is 15 minutes, that means we have to get 15-minute dissolutions for our preparation. So pharmacopoeia tablet, as per the pharmacopoeia, tablets are solid, flat and bioconvex dishes. And unit dosage form means the dosage form contains a unit drug, unit dosage form. So it is a unit one, that is if I taking one medicine, one tablet, so it should contain 500 mg, 1000 mg, it depends on the strength of the dosage form. And it is prepared by the compression. So compression means it is a pressure. When we exert pressure, the tablet will form. Otherwise, it will be a powder. Generally, compression is used by using machines. So, tablet is manufactured by compression. That means when we press the granules in tablet, I will discuss the granulation method. So, in granulations, we prepare the powders. It is a spherical powders, not the fine powders. So this spherical powders has a good flow property, good adhesion property. So when we press it, it will form a tablet. Hardness, it provide a hardness structure. So that's why it is called compressing a drug or a mixture of drug. That means when the tablet is prepared, there will be one drug or there will be more drug. Two products, like example glimepiride metformin tablet. You might have seen glimepiride metformin tablet. So in glimepiride metformin, these are anti-diabetic tablets. So it is a mixture of drugs with or without diluents. That means in that conditions diluents are used to increase the volume. Understood? So here I will add diluents, we will add diluents. So diluents will increase the volume of the tablets. Generally this tablet contains a active agent which is called active pharmaceutical ingredient. It is called API. So API with excipient. Excipient has no pharmacological activity. Instead of that, the API contains pharmacological activity. So diluents are excipients. So with or without excipient, that means we may add the diluents or may not be add the diluents. So next slide. Advantages. So when we prepare the tablet, our intention is to prepare a tablet, but why? So why it is advantageous as compared to the other dosage form? So other dosage forms, you might have know that we have different dosage form. So tablets comes under solid dosage forms. So generally tablet dosage forms are solid. So mainly solid dosage forms, liquid dosage forms and semi-solid dosage forms. So in solid dosage forms we have tablets and capsules. Mainly use tablets and capsules. So advantages of the tablets are, it is a unit dosage form and it offers a great stability, greatest capabilities for the oral dosage form, and it has a good precision. Like good precision means if I am adding 500 mg, that means it will provide 500 mg API. If I am adding 200 mg, that means it will give 200 mg API. And the least content variability, that means there will be no change of strength concentration. Strength means it comes from the concentration. If I am changing concentration, the strength will be different. So at the least content variability, that means when I said that compressing a tablet, so tablets are prepared in a machine. So that machine has a good precision, dose precision. That means if I am adding 200 mg, definitely there will be 200 mg and the least count variability. So there will be no change of concentration. Second is cost is lowest of all the oral dosage form. So cost is lowest for all the dosage form, oral dosage form. So oral means which are taken from the mouth. So oral dosage form like syrups. So syrups are prepared by using different liquids, co-solvents. Solvents are there, then sweetening agent, coloring agent, preservatives, microbial, means liquids containing mainly water and co-solvents. So there is a maximum chances of microbial contamination. That's why it has less stability. But as means opposite case, in solid we have powdered materials. That's why it is the lowest cost. We are not adding any antimicrobial agent. Sometimes it depends on the formulation design. Then lighter and compact. So tablets are generally very small size. It is prepared by compression. That's why it has small size, lighter and compact. Then easiest and cheapest to pick, package and strip. So tablets are, I will discuss later, tablets are packed mostly in the blisters and strips. So it is cheap, like strip, it is very cheap packing material, and blister containing aluminum and PVCs and PVDCs. So I will discuss later. So this package is very cheap, like PVCs. So nowadays you might have seen the metronidazole tablet. So metronidazole tablet, 10 tablets you will get around 5 rupees or 10 rupees. So why it is too much less cost? Because the packing material has very cheapest quality. So easiest and cheapest to package and strip. Then next point is easy to swallowing with least tendency for hang up. So it can be easily swallowable for the adults, but it will be difficult for the children's. That's why pediatric doctors mostly prescribe the liquid preparations. Then sixth point, sustained release products is possible. So in the later I will discuss coating. In the later chapters I will discuss the coating property, how we can coat a tablets. So tablets are coated by polymeric solutions. By that way, we can modify the release pattern of the API. So you know that when we take the tablet, it goes from the mouth to the stomach. Then from the stomach it goes to the intestine for absorption. So during this stage from mouth to the intestine, the gastric fluid is present in our stomach, where the tablet dissolved in the gastric juice. So by that way, sometimes few APIs are prone to the acid quantity. So prone to acid quantity means these are acid labile. It destroys the property of these acids destroy the property of the API. So that's why we use certain agents to coat the tablet. You might have seen that sweets sometimes coated by different colors. Then lozenges you might have seen like gems. Inside there is a chocolate and outer side is a coloring agents, coloring coating. So this type we prepare the tablets. So we use polymeric solutions to coating a tablet. So by this way, the release pattern means when the tablet API in a tablet, when API is present, it should release from the tablet to give a therapeutic effect. So when we give the polymeric coating, it reduces the release of the drug, and it also prevents from the acid solution which is present in our gastric stomach. So this is 6th number point. Sustained release product is possible by enteric coating. Next is objectionable odor and bitter taste can be masked by coating technique. So objectionable odor, that means we don't like this odor. Sometimes some odors is irritating. So objectionable odor and bitter taste. So sometimes few APIs are very much bitter, like paracetamol. You can take the example of azithromycin. So these are the very bitter taste. These APIs are very bitter in taste. So we can mask the taste by using coating. So as I said, I will discuss later the coating chapters. In that chapter, I will discuss how we can coat a tablet. So objectionable odor and bitter taste can be masked by coating technique. Next is suitable for the large scale production. So students, these tablets is very suitable for the large scale production. That's why you might have seen many medicines which is available in our pharmacy are tablets and capsules. So it is very cheap and it is easy to prepare. It has high stability, as I said. So it is suitable for the large scale production. Next point is the greatest chemical and microbial stability over all dosage form. As I said earlier, it has great stability. Stability means good condition. When I place a tablet in a humid area, so humid area means where moisture is present. So there is a high chances of microbial contamination. So microbial contamination means there will be the growing of microorganisms like bacteria, fungi. So microbial contamination may be present in humid areas, but it is less contaminating during the dry condition. That's why our product solid dosage forms are mostly dry condition. So greatest chemical and microbial stability over all oral dosage forms. So pediatric dosage forms like liquid suspensions, these are comes under oral dosage forms, but these are liquid, but we are discussing solid. So we have great stability. Next is product identification is easy and rapid, requiring no additional steps when employing an embossed or monogrammed punch faces. As I said earlier, we can use different coloring agents to distinguish different tablets. Okay, so going to the next slide, we will discuss the disadvantage here. So difficult to swallow in case of the children and unconscious patients. So you know that when children's they have no teeth, and sometimes these are pediatric patients, so we cannot use the solid dosage forms. It may block the pharynx area. So next is drugs sometimes resist to the compression. So that part we cannot use. that type of material we cannot use for the tablet. And sometimes few APIs are moisture sensitive, so sometimes moisture sensitive materials we cannot use in a normal condition. Then drugs with poor wetting, slow dissolution properties. So I will discuss later that dissolution is another chapter. Dissolution is a evaluation test parameter for the tablets. So here I will discuss only that dissolution is, for your understanding, dissolution is the solubility. So when I place the sugar in a glass of water, it should miscible with the water, it should be clear water. So that part is called the dissolution process, means solubility. But in case of the API which are slow dissolution property, means their solubility is less, and these are also called as poor wetting. So that part of material we cannot use, because in our GIT we have gastric fluids. So our tablets should be dissolved in our gastric fluid. But instead of that, these tablets means when APIs have less dissolution property, we cannot use for the tablet. Next is beta testing drugs. Sometimes it is objectionable and odor is very irritating, so we cannot use for the tablets. It may require the coating properties, as it says that those are sensitive to oxygen, may require encapsulation. It is called a seal coating. That coating is here, it is mentioning, or coating. So this coating is called seal coat. Seal coat means it provides a barrier for a moisture penetration. So this case, capsule may offer the best offer also. So we can use the capsules. Capsules is another chapter we will discuss. So next I will discuss the capsules also after the tablet. So in capsules, these are hard gelatin material. Capsules are two types, hard and soft. So mostly we use hard gelatin capsule because it is cheapest. So we can use hard gelatin capsule for the solid dosage form. Okay, so in that case we can use capsule to entrap a moisture sensitive material. Next is type of tablets. So tablets is different type, as pharmacopoeia said, biconvex, flat, round. Okay, so tablets are classified into different names, different category. Like when we say tablet ingested orally, so tablet will be ingested orally means those are taken by the mouth. So compressed tablets, multiple compressed tablets, then multi-layered tablet, sustained action tablet, enteric coated tablet, sugar coated tablet, film coated tablet, chewable tablet. So here there are different terms. So compressed tablets, as I said earlier, it is prepared by compression. Mostly these are uncoated, means there is no coating on the tablet. Then multiple compressed tablet or pressed coated tablet. So multiple compressed tablet means these tablets have different compression, like there will be 2 layer, 3 layer. So mostly available 3 layers, up to the 3 layers. That means 1 layer containing immediate release, 2nd layer containing sustained release. So mostly these are called bilayer tablets. So here also we can say that multiple compressed tablets or press coated tablets. Also it is in point number C, it is said multi-layered tablet. Next is sustained action tablet. So sustained action tablet, as I said earlier, we can prepare by using coating. So we will use different polymeric solutions to prevent the release profile of the tablet. We can modify the release profile of the tablet. When the release is slowly, so that part is called a sustained action tablet. Next is enteric coated tablets. Means this term is new for you. So enteric means intestine. So enteric coated tablet. So this tablet is released at intestine. Enteric, by the term enteric means intestine. Coated tablets means this coating allows the tablet release at intestine. So we will use here different type of polymers also we will use polymers here. So polymers plays a critical role here. So one example is phthalate polymers. So these phthalate polymers helps to modify the release profile of the tablet. Tablet means API. Okay, so API. So this API means APIs which are used for the enteric coated. So these are prone to the acid. It is acid labile drugs. So acid labile drugs, if we coated it with the polymer solutions, so it will prevent the dissolution of this or destroying of the API in stomach. gastric fluid. So it will prevent from destroying the API in stomach. So that's why it is called enteric coated tablet. When the tablet reaches the intestine, it allows the dissolution. So this polymers has the dissolution property at alkaline side because our intestine is alkaline. So this polymer like phthalate, as I said, phthalate is a type of polymer, enteric coated polymer. So this polymer dissolves at pH around 7 and above. So our intestine, it has pH around 7 and above. That's why this polymer dissolves at the pH, and also it allows the dissolution of the API. Next is sugar coated tablets, which is mostly used for the children's and normal patients. It is not suitable for the diabetic patients. Sugar coated tablets. So coating pen is used for the normal sugar coating tablet. So I will discuss during the coating chapter how sugar coated is used. So sugar coating is prepared. So sugar coated tablet is prepared by using sugar solutions. Normally you understand that sugar coating, by the term sugar is used to coat the tablet. It has different steps during the coating. I will discuss later. Next is film coated tablet. So by the term you have seen that film. So film means one layer. So film coated tablet, this film is also prepared by the polymers, and polymers plays an important role. So film coated tablet is prepared by using a polymer. Next is chewable, and one more thing is film coated tablet is used to modify or to prevent the bad odors or bitter taste, like that property. So different property, like as I said, as we have already discussed, that sometimes drugs are bitter in taste. A drug may be non-odorous, means it may be irritating to someone. So we can use film coated tablet, or film coated tablet you can use for the moisture penetration also, like it is called seal coated. Then chewable tablet. Next is chewable tablets. So chewable tablet, one example is albendazole tablet. Chewable tablet you have seen, albendazole. So albendazole tablet is a chewable tablet. So chewable tablet means when you take this tablet, it may dissolve in the mouth. You have to use it for a one time. It is not multiple use. So chewable tablet is one type of tablet. Next is tablet used in the oral cavity. So what oral cavity? Our mouth. Oral cavity means our mouth. So in the oral cavity we use certain tablets like buccal tablets, sublingual tablets, lozenges tablets, and dental cones. So you might have heard this term na, buccal. So buccal means our cheek, side of the cheek. So when we place the tablets in the side of the cheek inside our mouth, so it is called the buccal tablets. Then sublingual. So sublingual means beneath the tongue. Beneath the tongue. So when we place a tablet below the tongue, so it is called the sublingual tablet. Then next is the lozenges and traces. You might have seen the lozenges, like different type of medicated tablets. So these are sugar, mainly prepared with sugar. So this type of lozenges I will discuss later. So lozenges tablets are also used for the treatment. Then dental cones, as the term said, the dental means dental, so cone. So it is a triangle type tablets which is placed in the dental cavities. Next is the tablet administered by other routes, like implantation tablet. So implantation means when we place something in a somewhere. So in this case medicinal chemist, or this is the pharmaceutical background. So implantation means when we place the tablet on our skins. So implantation tablets. So there will be a certain insertion and we will place the tablet below the skin. Next is vaginal tablets. So vaginal tablets is used in the vagina for the microbial bacterial infections. So we can use the tablets for the vaginal infections. Next is tablets used to prepare the solutions. So effervescent tablet, Disprin tablet you might have seen. So one example is effervescent tablet, Disprin. So effervescent tablet contains, how it contains, what it contains. So tablet contains some agents with API, as I said earlier, API plus excipient. So excipient we will use bicarbonates, citric acid. So bicarbonate and citric acid I will discuss later. Citric acid and bicarbonates, when we mix together in a tablet, so when we place in it solutions, it will form the bubbles, it will release the air. So that's why it is called effervescent tablets. Next is dispensing tablet, and next is hypodermic tablet, and another one is tablet trisurates. So as you know that hypodermic means it is below the skin. So hypodermic tablets can be used, and tablet trisurates. You can see the image of the tablets. Tablets are uncoated. When tablets are uncoated, that means there is no film, there is no coating. So you can see these tablets structures, it is a flat type, spherical. So there is no coating. So coating, as I said, what type of coating? What are the coatings? Different type of coatings: film coat, enteric coat, and sustained release coat. You all means till now we have discussed this type of coating, seal coat. So in this case, when there is no coating, it is called as uncoated tablets, and it is also prepared by compression, and there is no coating. Next is multiple compressed tablet. So multiple compressed tablets, as I said, there is a inside core, there will be another layer. So you might have seen this one. Inside core is green color and outside is blue color. So green color is core material, that means it contains the API and excipient, and outside it is blue. So blue color, the tablets are prepared to separate physically or chemically incompatible ingredients. So sometimes this type of coatings, multiple compressed tablets, is used with the help of coating to avoid the incompatibility. And incompatibility means there may be a chances of reaction between two APIs. Suppose one API A, another API is B. So when I mix this A and B, so it may be a reaction, there may be a reaction, and it may degrade the quality of the product. Suppose A and B, one API has a tendency of moisture, for the moisture. So if it entraps the surrounding moisture, so there will be the melting. So A and B, when we mix together, there will be the melting, and due to that melting there will be the water present. So it may contaminate the product, it may be prone to the microbial growth. So that's why to minimize these problems, we can use different type of layering with the help of coating. So here it is mentioned, the ingredients of the formulation except the incompatible material are compressed into a core tablet, and then incompatible substance along with necessary excipients are compressed over the previously compressed core tablet. Next is multi-layered tablet. As I said, one example is metformin. One layer is metformin, another layer is glimepiride. That means in the metformin glimepiride tablet we will get two layers. Understood? So we will get two layers. So in this picture you might have seen three layers. One is yellow and sometimes somewhat yellow, another one is brown, and another one is white. So that means this tablet contains three layers. So tablet consists of two or more layers of material compressed successively in the same tablets. So mostly I want to share that these tablets are prepared by Dicota tablet. I will discuss later. Dicota tablet machine is an instrument which is used to prepare the multi-layered tablets. Let's discuss next one, sustained action tablets. Now you can see this image. We have one barrier, inside that there is a polymer and a drug. As I said, the sustained release tablets are prepared by using polymers. So you can see this image, one barrier is there, then another one is inside that we have drug particles and polymers. So solution is polymer, and the yellow colored or brown colored, you can say that brown color. So brown color material is drug. So now the next arrow side, right hand side, you can see this. The particles are removed or released from the barrier. So it is called a sustained release. That means from the coating area polymer will be released, or polymer allows the release of the drug slowly. That's why 2 particles still remain inside the barrier and 3 outside the barrier. That means in a time duration, few particles are outside the tablet and few particles APIs are present inside the tablet. So sustainability tablets are designed to achieve prolonged therapeutic effect by continuously releasing the medicament over an extended period of time after the administration of a single dose. So I can give you example is rabiprazole tablet. One example is rabiprazole tablet, that is which is marketed already available in market. You will find Reblet tablet. So Reblet is a sustained release tablet. So if you take in the morning, it will last for the night. The action will last for the up to the night. So it is called the sustained action tablet. So next is enteric coated tablet. So what is enteric coated? As I said earlier, intestine, is not it? So intestine, that means this tablet will release at the intestine. So we are using polymers which will prevent the release of the drug at the stomach. Otherwise the drug will be, that means API will be degraded in the stomach. Why? Because in the stomach we have acids. So these APIs are acid level. That's why we are using enteric coating. So these compressed tablets mean for the administration by swallowing and are designed to bypass the stomach. So it is also called as fast pass metabolism. So bypass the stomach and get disintegrate in the intestine. So first time you are getting this disintegrate term in this presentation. So disintegrate means breakdown. When tablet gets contact with the water, at first the tablet breakdowns into different particles. So this process is called disintegration. Okay, and when the tablets is soluble in the gastric juice or any solution, it is called as dissolution. Understand? So disintegration and dissolution, it is a important for the tablet dosage form. I will discuss when I will discuss this quality control of the tablet. So disintegration, remember, breakdown. Dissolution means soluble. Okay, so soluble in the intestine. Next is sugar coated tablet. So sugar coated means the coating material is sugar. So sugar coating is done to mark the bitter and unpleasant taste of the medicament. Next is film coated tablet. So as I said, film coated tablet, okay, we are using polymeric solutions to coating the bad odor and bitter taste of the material. So it is unlike the sugar coating, this film coating is very shining, means it is elegant. It provides the elegant to the tablet. Appearance will be good because it is said film coated tablets are compressed having a thin layer of polymer capable of forming a skin like film. Understand? So here we are discussing film coated tablet. Next is chewable tablet. So chewable tablets is a oral dosage form which are intended to chewed in the mouth prior to the swallowing. One more important point is there is no disintegration for the chewable tablet. Remember this point, there is no disintegration time for the chewable tablets. So because these are intended to chewed in the mouth prior to the swallowing and is not intended to be swallowed intact, okay, there will be no point of disintegration time. I will discuss, as I said, I will discuss disintegration and dissolution in next quality control of tablets. Next is buccal tablet. In the pictures you can see how buccal tablets is placed. It is in between the cheek and gum and pertaining the direct absorption of the active ingredient through the oral mucosa. Next is sublingual tablets. So these are placed beneath the tongue. As I said earlier, it provides a good absorption for the drugs. And lozenge and process. Okay, so these are sugar materials and mostly this is for the mouth problems, like sometimes pain will be there, dental pains, then throat pains, throat irritations. Okay, so this type of medicine can be prepared by using lozenges and process. Next is lozenges. Then dental cones, it is placed in your dental cavities. Next is implantation tablet. So in the pictures you can see beneath that it is a small surgical procedure. By this process we place the medicament below the skin. So tablets are placed under the skin or inserted subcutaneously by means of a minor insertion, surgical operation, and slowly absorbed by this way. Next is vaginal tablets. So it is placed in the vagina to prevent any bacterial infections or any avoid infections. Then effervescent tablets, as I said, Dispin is another means important, or mostly you know that Dispin is a tablet. So where release of the gases is there because there is a presence of bicarbonate and citric acids. Dispersing tablet. Then hypodermic tablets. So hypodermics are intended, means hypodermic, these are the tablets, one type of tablets, hypodermic. So it is mixed with the water for injection. I will discuss later when I discuss this parenteral dosage form. Water for injection is a main solvent for the parenteral dosage form. So water for injection, one important point is that why we are using water for injection during the parenteral products or in the preparation of the parenteral products, because it has no endotoxin. The endotoxin name is pyrogen. So when pyrogen is present, there may be a chances of fever. Okay, so when the pyrogen is present, we cannot use that water for the parenteral dosage form. That's why we use water for injection. It is free from pyrogen. And important is, what is pyrogen? Pyrogen is an endotoxin. So these are intended to be added in water for injection to form a clear solution which is to be injected parenterally. So that means these are in the form of, initially it is in the form of tablet and it is mixed with water for injection. As I said, there will be a dissolution. So in that way it will form a clear solution. Then we will take the help of injection and provide the parenterally. We will deliver the drug parenterally. Parenterally means in the veins, arteries, in the blood. Okay, so here we will inject parenterally. Next is tablet tricyclics. These are small tablets, that's why it is called tricyclics. It is cylindrical in shape and it is a potent medicament. So next is the manufacturing of the compressed tablet. So manufacturing of the compressed tablet I will discuss later in the next classes. Simply I want to discuss here that manufacturing is prepared by using compression. Tablets are prepared by compression. Then compression of the granules I will discuss later. Compression, that means compression of the granules. Next is coating of the tablets and quality control of the tablets. As I said earlier, so I will discuss how we will prepare the granules. So granules is a nothing but a powder, but it has large size than the larger size as compared to the free flowing particles, powder particles. It is larger than the fine particles and it has a spherical shape and it allows the free flowing of the powder. So that's why granules we need during the manufacturing of tablets. Next is coating of the tablets. I will discuss. It is a vast chapter. Coating is, we have sugar coating, film coating, enteric coating, sustained release coating. So we have different type of coating. So I will discuss. Next is quality control of the tablets. So quality control of the tablets. So it is another chapter. Quality control means to evaluate the parameters of the tablets. Means it contains the tablets as per the monograph. As I said earlier, monograph provides us specifications. Suppose hardness is 5 for one tablet. So when we prepare the tablet, we will check our tablet whether it is comply our pharmacopoeial specifications or not. It should match the pharmacopoeial specifications. So if I say my tablet has a dissolution time is disintegration time is 45 minutes. So it should comply the pharmacopoeial specifications. In pharmacopoeia, it should be mentioned that tablet, suppose tablet paracetamol, it should be disintegrate within 15 minutes. So if I am preparing a tablet, paracetamol tablet, it should disintegrate within the 15 minutes. That means my tablet should be matched with the parameters of Indian pharmacopoeia. Clear? So I will discuss this chapters manufacturing of the compressed tablets in the next classes. Thank you everyone.